I am a gerontological clinical nurse specialist, which means I have a master's in clinical nurse specialty with a gerontological focus, and I am a wound ostomy continence nurse at our wound clinic, and I also run our inpatient wound program. Evidence would mean what has been proven clinically through research, through randomized controlled trials, meta-analysis, whichever way we can get the evidence. It's a little bit hard to get it in wound care at this point because it's very hard to do studies on live patients, and especially with our patients that get excluded from a lot of the RCTs that are out there because of all their comorbidities. Meta-analysis are great because they give you a wide range of different things that have occurred in the scientific world, especially in wound care when you have so many different collaborative groups that are doing research. Clinical trials are always great as well. Again, it's a little hard to get that kind of information because a lot of our wound patients get excluded from those types of trials. And of course, you can always rely on what has worked for you. We follow a lot of the meta-analysis, especially related to guidelines that have been published, and follow those standards of care versus just what a rep or someone says, hey, that works. No, we want to go by the evidence. Insurance companies tend to follow what governmental standards are. So yes, I believe as Medicare, CMS requires evidence-based practice and pay for performance, that insurance companies will follow along as well. We especially see that a lot currently with pressure ulcer prevention and things that we're having to use inpatient-wise.